Dr. Robertson, before we get started, could you go ahead and please state your name for the record and spell your last name?
Natalie Robertson, Robertson.
You're a medical doctor, is that correct?
Correct.
Can you tell us about the education or the training that you have in order to become a doctor?
Yes. I have a Bachelor's of Science from Boston University. I have
And
my...
I interrupt you very quickly. Can you move that
Oh,
microphone
yeah.
a little bit closer? Thank you.
Is that better?
Yes.
Bachelor of Science from Boston University in Health Sciences, a medical doctorate from Drexel University, and I completed a residency in emergency medicine at Dartmouth-Hitchcock Medical Center.
Okay. And with respect to, or when did you graduate from Drexel with your MD?
2021.
Okay. And at what point did you complete your residency?
It was a 3-year residency, so 2024.
So 2024?
Yes,
And are you board certified?
I am.
And when did you receive your board certification?
I finished my last exam in March of this year. It took a couple months then, so.
Okay. And you currently are board certified in emergency medicine, is that correct?
Correct.
Okay. Now, you indicated that you had or were a resident with Dartmouth-Hitchcock Medical Center, is that correct?
Correct.
Can you explain to us what a residency is?
Residency is the part of your medical training that you complete after you graduate medical school. So you have a medical doctorate, then you do residency in whatever specialty you are going to become a doctor in or specialize in. So mine was emergency medicine. That was a 3-year process at Dartmouth. There's some varying lengths. And during that time, you are licensed under a training or restricted license saying that you are practicing medicine within a residency program. You care for patients. There's a somewhat of graduated responsibility. So by the end of the residency program, you have more responsibility than the beginning.
Okay. And when you were serving as a resident at Dartmouth-Hitchcock, from what I understand from your testimony, you were serving in the emergency department?
Correct.
Okay. And while you were serving as a resident with Dartmouth-Hitchcock Medical Center, where were you based out of? Like what hospitals?
Our main hospital was at the main Dartmouth-Hitchcock in Lebanon. We also did rotations at Cheshire Medical Center, at the Elliott Hospital in Manchester, as well as shock trauma in Baltimore.
Okay. And when you say we, in terms of Cheshire Medical Center, did you serve any portion of your residency at Cheshire Medical Center?
Yes, we complete 2 months at Cheshire Medical Center, 1 month during our 2nd year of residency and 1 month during our 3rd year of residency.
Okay. And I'd like to ask you, and my math skills are horrible, so let me go with your recollection. With respect to the residency that you were doing in March of 2024, were you stationed at Cheshire Medical Center?
Yes.
And would that have been your month in your 3rd year of residency?
Yes, that was my 3rd year.
Okay. Are you currently employed as a medical doctor?
I am currently on maternity leave, but I am employed as a medical doctor, yes.
Okay, and you're employed where?
At Lawrence General Hospital in Lawrence, Massachusetts.
So in March of 2024, you are a resident at the Cheshire Medical Center, and that's located where?
Keene, New Hampshire.
And at that time, you're working in the emergency department?
Correct.
Okay. So I want to direct your attention to March the 1st of 2024. Were you working on that day?
Yes, I was.
And I guess let me back up a little bit. The emergency department at Cheshire Hospital, can you talk to us a little bit about what that looks like?
It is a pretty standard, smaller community emergency department. There were generally 2 to 3 either physicians or APPs on at a time. It's a circular department, so there's patient care rooms around kind of a center area where there's supplies, as well as 2 areas for physicians and nurses.
And as a resident there at Cheshire Medical Center, what were the responsibilities that you had? You indicated you would be licensed under a conditional license. What kinds of things did you do as a resident at Cheshire Medical?
Yeah. So as a 3rd year resident at Cheshire, I would generally see patients, or I would see patients on my own. Initiate.
Sorry, did you say you would or would not?
Would. Initiate their care and workup, and then at some point present them to an attending physician. Again, there's some caveat there. If someone came in who was very, very ill, often then an attending would walk in the room with me. But most of the time, as a resident at that point in your training, you are treating and seeing patients independently, and then at some point the attending signs off on your care.
Okay. I mean, you're just months shy of graduating the program, so you're
Correct.
functioning pretty much on your own with backup from a resident, or not a resident, I apologize, an attending.
Attending. Yeah.
Okay. So as a resident or as a doctor at at Cheshire Medical Center, how would you normally be dressed? What would you look like?
They had hospital issued scrubs at Cheshire, so we had navy blue scrubs. I wore my badge with my picture on it, usually a stethoscope, and then some papers in my pocket. I don't generally wear a white coat.
Now, in your capacity as, well, you've already indicated that you were able to see patients. Is that fair?
Correct.
Okay. Did that include patients who were pediatric patients, like children?
Yes.
Okay. Speaking generally, when you're seeing a patient, any patient in the emergency department, whether as a resident or now as a doctor, what kind of steps do you take when you treat and evaluate them?
It depends a bit on the condition of the patient when they arrive, but assuming that they are a stable patient who's talking to me, we walk in the room. Sometimes the nurse, or if they're brought in by EMS, someone will give me some information before I walk in the room about why they're there. Sometimes I don't have that information. I walk in, I ask them why they're there. I check their vital signs. I do an appropriate physical exam, and then initiate a workup, whether that's blood work or imaging or other things to make my diagnosis or to treat them.
What's the purpose of getting information from the nurses or the people accompanying the patient, as well as the patient, before you just launch into your physical exam?
I mean, those people generally have other helpful information, not always. If there's a 40-year-old who walks in and has a stomach pain, they can probably tell me everything about their stomach pain. If someone is coming in by ambulance, they can provide me, EMS can provide me with vital signs that were taken in transport, or if they did any interventions already. If they're picking someone up from an accident, they can tell me details of the accident. They just provide a more holistic story of why they're there.
And is all of that information that you would receive, whether from those sources like EMS or nurses or accompanying persons, as well as from the patient, including that child, are those all things that you take into account when you're evaluating and examining that patient?
Yes.
Now, when you're talking about information just in general, what are the kinds of pieces of information that you're trying to obtain about the patient in that initial evaluation stage?
You mean when I'm initially looking at a patient?
Yeah, when you walk in, you ask them what's going on, what
yeah.
kind of information you're trying to get, and how does that help you?
I'm trying to gather why they're there, why they're seeking care, and that directs me in what to examine and what tests to order. I'm trying to get information about their general health, their medical history, things like that, because again, that helps guide me towards what kind of workup they might need.
Okay, when you say workup, what kind of tests you might order, or what you might look for
Correct.
on your body?
Yes.
Okay. Now, in terms of, and have you, or let me back up, because there's multiple parts and I'm trying to ask it at one.
Yeah.
While you were at Cheshire Medical Center, did you have occasion to treat pediatric patients, like that 4-year-old you used as an example who had a stomachache?
Yes, yeah. I see pediatric patients everywhere.
And do you see pediatric patients in your role as a doctor now?
Yes.
Okay. Is the approach that you use in evaluating and treating a pediatric patient, so a child, the same as the approach that you use when you treat an adult?
It depends on the age of the child. Obviously, an 17-year-old is very close to an adult. A 3-year-old is not. But no, it has to be different depending on the age of the person.
Okay. So when you treat a pediatric patient, and when you say pediatric, is it anybody under the age of 18?
Yeah, I think I'm not a pediatrician.
Yeah.
I believe pediatricians are certified to take care of people up to the age of like 22 or 23. I'm not sure. I generally, colloquially, pediatrics is under 18.
Okay, I just wanted to understand a range of what
Yeah.
age we're talking about. So when you treat a patient who is a child, and I'm not talking about those 18-year-olds, but somebody younger, under the age of like, say, 7, around the age of like 5, let's say. That seems like child, right?
Yeah.
Are there any extra steps or considerations that you have to make in conducting that examination or evaluation?
So in a kid that age, around the age of 5 or 5 and under, obviously a lot of information gathering is not only from the patient but from other people, because they are not always, aware of their health history or have a, complete understanding of things around them. Also, the examination and everything, when you're talking to a child, you have to use age-appropriate explanations of things. they're more likely to be very scared of the medical system, and so there's a lot more effort put into making them comfortable, and to gaining their trust is a little bit more difficult than with an adult.
Okay. No matter who you've obtained that information from, the other people that you've talked about, whether it's caregivers or people with them, all of that information that you're gathering, are you using it in order to medically treat the child?
Yes.
Now, as part of your role in examinations, you get a history of the medical treatment for a person?
Yes.
And then do you obtain information about sort of the issue that has brought them to you?
Yes.
Okay. In terms of when you have a young child who's been brought to you and is being treated or evaluated in your emergency department, can you sort of walk us through what you would say and how you would handle talking to a young child in order to get the information you need to treat them?
Yeah. So someone who's around the age of 5, generally, again, I get some information about why a person is in the emergency department before I'm in their room. You know, a nurse has evaluated them, or they have come in by EMS. Somebody has some information for me. Then I walk in the room and I introduce myself as Dr. Natalie. I explain to them that I am a doctor that works here. I am here to help them. I'm going to do a checkup like they receive at their regular doctor. I tell them I'm going to listen to their heart and their lungs and check their ears and their eyes and their nose. I usually, make some joke about how I'm not going to give them shots like their regular doctor. And then around a 5-year-old can usually talk to me. And so I ask them, do you know why you're here, or what is bothering you? Some sort of open-ended question.
What's a wellness check?
A wellness check often means that a child is, I don't know if that's an official term, but I generally use that term, and many doctors do, as like a child is brought to the emergency department and they don't have a specific injury or complaint. They weren't at home having an asthma attack. They weren't in a car accident. But they are there for some reason where we are being asked to generally look at them and see if they are injured in some way.
Did you have a specific shift that you tended to work at Cheshire as a resident that last semester? Short month?
Yeah, at Cheshire, we did not work overnight, so we were either working a morning shift or an afternoon shift.
At some time on March the 1st of 2024, do you recall 2 young girls being brought into the emergency room of Cheshire Medical Center by ambulance and accompanied by police?
Yes.
Do you recall what purpose they were there for?
As I recall, they were brought in for essentially a wellness check to check for injuries.
Now, I want to focus specifically on the older of those 2 children. Did you physically examine a 4-year-old child named Duren?
Yes.
I'm going to show you what I've marked for identification purposes. Make sure I have it the right way. As State's Exhibit 16 in this case. Do you recognize this image?
Yes.
Okay. Do you know who that person is in the image?
Yes, the
Who is
child you just mentioned, Ellen.
Okay, so that's the child, Ellen. Now, in this image, she's seated. Is that fair to say?
Yes.
Can you describe where she is in relation to Cheshire Medical Center?
She is seated on a patient gurney. It looks like there's some blue kind of pads around it, which we sometimes use when children are seated so that they don't roll off of the gurney. And I can see in the corner, and do remember that she was in an enclosed room within the Cheshire Emergency Department.
And what does that mean to be in an enclosed room?
In the emergency room, sometimes people are in hallway beds or are in different, trauma bays or things that just have curtains, and that is a room that has a door that closes.
Okay. Permission to publish to the jury, Your Honor? I'm sorry, I skipped a step, I apologize. Your Honor, at this time, the state would move to strike the identification of State's Exhibit 16 and admit the item as full. No.
The ID may be stricken from Exhibit 16. It shall be considered a full exhibit, and you may publish to the jury.
Thank you, Your Honor.
Certainly.
When you were evaluating Elowyn Duren, was she able to provide you with any of her medical history that you recall?
I don't recall specifically if she could tell me her medical history.
Did she have a health issue that day that she asked you for help with?
She did. On initial questioning, she did not, and then told me that she had an earache, or her ear hurt.
What do you mean she initially told you she did?
Like I said, when I generally ask kids open-ended questions, is anything bothering you? She did not have any complaints.
And how did it come to be that she told you that she had an earache?
I asked if anything hurt on her body, and she pointed to her ear.
Okay. When she pointed to her ear, do you remember if she told you anything about why her ear was hurting?
I believe I asked her, but I don't remember the exact quote. It's in my documentation,
Okay.
if I can see that.
Dr. Robertson, I'm approaching you with State's Exhibit 17, which is identified only, okay? I do have... Marked for identification purposes as State's Exhibit 17. And with respect to this document, you've indicated that there are some records that may help you with your recollection of your evaluation and thereby treatment of Ellen Duren. Is that correct?
Correct.
Okay. You are free to look through this entire document, and I would ask you to go ahead and make sure that these are the records that are associated with her. And I have a tag just so that I can find something easily. You can disregard that or not. Do you recognize State's Exhibit 17?
Yes.
What is it?
This is her, it looks like full ED record, including my physician note, but also nursing notes and consultant notes.
Okay. And when you say that you see your physician note, can you just tell us there's a page number at the bottom so that we all have it? What page number are you referencing has your physician notes?
It starts on page 22.
Oh, I'm going to ask you for a different number.
Oh, sorry.
Page 22 of the records in the bottom corner. We like to add more numbers.
Oh, 00.
Yes.
Okay, so 002598.
2598. Thank you. Now, you had indicated that you had asked Elwyn about anything that was wrong with her, and at first she had said no. Is that fair to say?
I don't remember the exact way that I phrased the first question, but looking at my notes and with my recollection, I believe she did not initially have a complaint.
Okay. And when later did you inquire as to whether she had any injuries?
Yes.
And is that the moment where she told you that her ear hurt?
Yes.
And which ear did she point to?
Pointed to her left ear.
Okay. Did you then ask her, and without telling me anything at this point, but did you then ask her? Oh, absolutely. If you can put them right on the side, if you can close the medical records, if you can put them right up on the table there. Thank you. Did you then ask her how her ear got hurt or how it was injured?
Yes.
Okay. Can I ask you, in terms of examining, treating, and evaluating somebody, why is that important for you to know?
Yes. So if a child tells me their ear hurts, I ask them more about why it hurts or if it was injured in any way. An ear hurt can mean that there's an infection. An ear hurt can mean there's an injury. A follow-up question to why an ear hurts is very important. Those are very different pathologies.
Okay. And so depending on the answer that you're provided with, you know whether you're essentially swabbing for an ear infection or looking for something deeper or more meaningful. Is that fair to say?
Yeah.
Okay. Now, and again, without saying anything just yet, did Elwyn give you, and not telling us what she said, just trying to be very clear, did Elwyn explain to you how her ear was hurt?
When I asked what happened to her ear, how her ear was hurt,
Did she provide an answer?
she provided an answer, yes.
Okay. And based on her answer, did you have an understanding of what you needed to look for or do next?
Yes.
Okay. And based on her answer, were you able to determine a way that you were going to treat her medically or evaluate her medically?
I would say her answer in combination with a physical exam.
Your Honor, may we approach?
Yes.
Dr. Robertson, when you inquired as to Elowen's injuries and asked her how she had gotten hurt or how her ear had become hurt, what did she tell you?
The exact quote is in my record. Am I able to?
What do you remember her telling you?
I remember her telling me that something along the lines of, Daddy hurt Mom and me. There was a lot of blood.
Did you follow that up by asking her if she was hurt anywhere else on her body?
Yes.
And did she indicate whether she was hurt anywhere else?
Again, my record, I believe, it says she gave me a vague answer of yes, but couldn't pinpoint anywhere else specifically that hurt.
Okay. And I see you hesitating a little bit with looking at State's Exhibit 17, help refresh your recollection.
Yes. Yeah. So, yes, I asked her if anything else on her body hurt. She stated yes, but when asked to point where, she says, I don't know.
Now, based on hearing that information, that the dad hurt her and Mom and there was blood, was there anything else that you had to consider besides her ear in terms of your examination or evaluation?
Yes.
Now, I did want to ask you, you had indicated that when you said the statement that Elowen gave to you about why her ear was hurting, you had said, I think. Okay. I think you had said, I think that what she had told me.
Yes, I didn't
was
have.
that, so in looking at these records, would those refresh your recollection as to the full statement that
Yes.
she gave? Okay.
Yes.
If you could go ahead and take a look. Just at the statement that she gave you, and when you have an opportunity to refresh your recollection, you can put that document aside.
Okay.
Did she, was the information that you gave us, which was that dad hurt me and mom, is that the full context of what Ellen had told you?
No.
Okay, what did she say?
Mom and dad were fighting, and dad. Mom and,
Sustained.
The document is now aside. Did that help refresh your recollection as to what Elowen told you?
yes.
I know it's about a year and a half ago, so I understand. What did Elowen tell you?
Mom and dad were fighting. Dad hurt mom and me. There was a lot of blood.
Based on the fact that blood was mentioned, you had indicated just a minute ago that that made you have to look a little bit differently at Elowen. Is that fair to say? And that may be a bad way of phrasing it, so I apologize.
Yes, I mean, my job was to generally look for injuries on her. The fact
Now, based on the information that she gave you, what kind of an examination or how did you examine Elowen Duren?
So based on that information, her complaint of some sort of pain or problem with her ear, I did a more full ear exam, which just basically on a child is looking in their ear, moving around the ear. In general, how I examined her is she received a full exam. I checked her skin all over her body for signs of injury. I, did a neuro exam where I observed how she was communicating with me, how she was moving her extremities, checked her pupils, looked at her eyes, looked at her mouth, her nose, listened to her heart and lungs, felt her abdomen.
Okay. And in conducting that examination, is it fair to say that you didn't find any injuries on her body?
Correct.
Okay. And her neurological, like her talking to you and her movement of her limbs was fine?
Yes, her neuro
Ruled out
exam.
any possibility that she had any head injuries as well, correct?
Yes, she had a normal neuro exam.
Now, with respect to the ear, when somebody comes in and complains of ear pain, did you have any information that you had received that you used for the purpose of medically diagnosing what may have been wrong with her ear?
Yes.
What information did you use to help figure out what her ear pain may have been caused by?
As in like what I was told by pre-hospital people?
So before, when you say pre-hospital.
Sorry,
you mean-
police, EMS, fire.
Okay, so
Yeah.
when Elowen came into the emergency department, she was accompanied by ambulance first, and then there were police officers with her, correct?
Correct.
And
When
you
I saw
received-
her, she was in a room already, so I don't know who exactly walked her into the emergency room.
Perfect. When you saw her and she was in the room, was she by herself, or were there officers with her?
There were officers with her. I do not remember whether I asked them to step out or not. I do and don't. Sometimes it depends.
Perfect. Were you able to diagnose in any way what her ear pain was caused by?
I was able to deduce what I thought likely caused her ear pain.
Okay, and what, if anything, was your, and when I look at records, there's the words MDM, or the letters MDM in the medical records. What does
Yeah.
that mean?
That's the medical decision-making portion of the physician note, which is basically where I discuss, what I think is going on with the patient. So if a patient has ear pain, that's where I sometimes explicitly list all the possibilities of what ear pain could be, or sometimes I just list the pertinent negative things, like it's, was not infected, was not this, and then come to some sort of conclusion.
Okay, so based on all of the information that you had from Elowen and from all of the other persons that you talked to when you were gathering the history and information you needed for your medical diagnosis, first of all, did you see anything when you conducted a physical exam of her ear?
No.
Okay, and you looked inside of it with that pointy thing with the light?
The otoscope, yeah.
Thank you. So did you or were you able to make that diagnosis?
Yes, the diagnosis that I came to is one that there's not a test that proves it, so.
Okay. And what did you indicate was your diagnosis with respect to Elowen's ear pain?
I think that she had injury to her ear due to loud noises, being in close proximity to a loud noise.